Good day, everybody. My name is Dede Optamno Gilbert, and I'm a Nigerian medic in training. This December, I'm going to improve the healthcare in my community by the following ways. First, I'll be having rigorous education of the public. I'll educate the public on the need for intending couples to have premarital counseling and screening, where they will have to screen for genotype, blood group, and rhesus HIV testing for all intending couples. I will tell them on the need for all pregnant women to do routine antenatal care screening, where they have to get registered to a health center, to get screening and to always have antenatal care. I'll be educating them on the need for all mothers to always have postnatal screening for their children immediately they give birth to their children, because most mothers in my area give birth in maternity centers. So I have to tell them on the need for them to always be having postnatal screening for birth defects and different abnormalities. I'll be telling them on the need for balanced diets of their children to prevent malnutrition, as well as telling them about the problems associated with malnutrition. I'll be telling them about the need for prompt immunization according to the NPI schedule of my country. The youth will not be left out. I will educate the youth about sexually transmitted infections, sexually transmitted diseases, and how these diseases and infections can be contracted, measures to prevent these infections and disease, and also their treatment options. I'm going to inform them about the need for routine retroviral screening and why people who test positive for the HIV virus have to commence their antiretroviral therapy immediately, and why they need to be compliant with their medication. I'll be telling couples, about the need for adequate family planning and contraceptive use for people who fall into the category why of those who need to be using contraceptives and who need to have family planning. I'll be informing the youths about the dangers associated with drug abuse. I'll be informing the youths and the entire populace about the need why everybody needs to be doing exercise, how exercise is important for our cardiovascular system, our entire body functioning, how it increases cerebral perfusion and even helps to make you mentally alert, all the importance of exercise. I will inform everybody about the need for routine medical checkup, why they need to always be having routine medical checkup, assessing all their organs, all their body system, all their body systems and everything in their body, why they always need to, especially the men have why the men have to be always assess their prostrates. The women have to assess their breasts, assess their cervix. I said prostrate breast and cervix because in my area the pathologies associated with prostrate breast and cervix is in the increase. I will also educate them on the need for them to be having regular blood pressure checks, regular blood sugar checks, and why all women we should be having regular breast examination. How they can even be doing self breast examination. I've informed the public about why they have to be having prompt presentation to the hospital whenever they have a problem, and why they also have to be compliant with medication and the need for compliance to medication. I'll be having some action points. I won't just be educating them. First of all, I will liaise with FHI in my community, because FHI have a good coverage in my community. I'll be liaising with FHI to take test strips so I can do retroviral screening for people in my community, and people who test positive for HIV. I'm going to submit their names to FHI so that FHI can start giving them highly active antiretroviral therapy. That's the heart. So I'm still going to link people who have severe acute malnutrition to NGOs, leaders that are well to do, and people who can also assist them so they can, because problem with malnutrition is just feeding. I will be doing daily morning exercise so people can burn fat, burn down excess calories. I will be doing free assessment of weight, where I'll use my weighing scale to get people's weights, get their height, calculate their BMI. I'll use my sphygmomanometer and my stethoscope to get their blood pressure, check blood glucose, assess for breast lump. I'll liaise with NGO so I can be doing free PAM, prostate-specific antigen screening, pap smear, breast scan, mammography. What I expect to see in the nearest future is a healthy population, reduced number of people who have sexually transmitted infection and STDs, reduced number of people coming down with sickle cell disease, healthier babies, healthier mothers, reduced morbidity, reduced mortality. Thank you very much. I'm Dede Optam.